Hello, this is Daniyal Ultrasound Clinic. Welcome back. We have got a patient. She is about 65 to 70 years old. So this is a post-menopausal case. She's complaining of heavy bleeding and pain in the lower abdomen and vaginal areas. Now on ultrasound, let's see what is coming out. Here, this is the pelvic scan of the uterus. Uterus appears moderate to massively enlarged. The endometrial cavity, the central part, is occupied by an echogenic mass which is showing heterogeneous echogenic areas. It's not smoothly echogenic, but there are also hypoechogenic areas as well. So this is called heterogeneous mass. Obviously, it appears a solid mass with internal hypoechoic areas, and it's occupying the entire endometrial cavity. Differential diagnosis usually includes submucosal fibroids, endometrial polyps, and endometrial neoplasms. So patient has to undergo further evolutions like Doppler, MRI, and histopathology. Now let's define further the consistency of the mass. Here the mass, this is mildly echogenic and showing irregular outline occupying the entire endometrial cavity and with heterogeneous echotexture. There are also hypoechogenic areas as well. So as the patient is postmenopausal, so in this at this stage of age, mostly these masses turn out to be neoplasms or CA endometrium. So let's see what comes out on histopathology and other investigations. This is the transverse section of the mass you see here. This is urinary bladder. Now we have to see other additional findings like kidneys, because in most of the cases, due to the pressure of the mass, uterine masses or pelvic masses, there is also hydronephrosis. So here is definitely here is the right kidney showing hydronephrosis. So this is obviously due to the pressure of the mass, which the mass is applied pressure on the urinary tract or ureters, so causing obstruction, which in turn is come out to be right kidney hydronephrotic. So this is liver also. This appears normal. We have to find out any mass for here. This is gallbladder showing normal. Now let's go to the left kidney, whether it's hydronephrotic or normal. So let us see. Left kidney is also showing slight pelvic dilation. So this is a bilateral hydronephrosis. The bilateral hydronephrotic kidneys. This is the epigastric area we have to see for the lymph nodes and other masses are like secondaries in the epigastric areas. There is no such thing. Only the mass is there in the pelvic area. So along with the description, I've told you the most likely differential diagnosis. So, the definite diagnosis would be done on is definitely on histopathological examination. Thank you.